Good morning, everybody. All right, it's Dr. Pearlman, and I want to make a quick video. So this is going to be a technique video, and I'm going to use Jen to demonstrate, but she actually does need an adjustment. A lot of people do anterior adjustments, so chiropractors or therapists out there that do anterior adjustments, and they're still using this part, like this part of their hand and this part of their hand, and they make these devices that are hard plastic, and you use it to cup hair so it doesn't hurt your hand. But the thing is, like me, I responded and still do respond really well to an anterior adjustment, meaning laying on my back, curled up with folding my arms and hugging myself, and the chiropractor getting the hand behind me and doing this. But too many people are like hurting themselves, or even I feel too much knuckle and fist. Guys, I just want to let you know, if you're doing this the right way, there's very little drop and there's very little pressure on the spine, and all of the weight is put through here. So you do this, close off this part of your hand, and then literally have the spine, or where your segmental contact meets your contact on here, to do the adjustment. So I'm going to show you what this looks like for a T5, T6, T4, whatever contact. And the reason I'm going to actually be doing it where I reach across Jen and I'm going to have my right hand in there is because she has excessive rotation in her upper thoracic, with bowing on the left side, and then on the opposite side of that right side is where the rotation is. So we're going to do it to respect the rotation and take the rotation out, so to speak. So watch the technique here and just watch how gentle it is supposed to be, because there's still too many people out there doing this wrong. Yes, she was palpated, and yes, I adjust Jen, my wife, often. And you don't have to help me here, Jen, at all. I like using the head turning cue. That's where I feel is the most important. So just look up in that way. And that's it. So big cavitation, subluxation corrected, nice crunch, gentle, and we didn't have to dive in. We didn't have to be aggressive, to like try to accomplish something that's easily accomplished through just giving them a cue, like lift your head up, look to the right, look up with your eyes, tuck your chin, whatever it might be. Those are more complex cues as to the reason why in the segment I want to move. But I wanted to make that video, so I hope people understand they should not be getting hurt by a practitioner in that position. And certainly for providers or practitioners, please understand that you're leaning into the bone, so to speak, through the tissue, this with this, and it's not this. So you guys got to stop. It's Dr. Pearlman.